The Republican-dominated state legislature has decided that now is the right time to advance new legislation to prevent employers from requiring that their employees get vaccinated. The mismatch between that reality and that proposal inspired one frontline ICU doctor in Indiana to go to the state capitol to plead with lawmakers to please not do this. Watch this. Watch what he said.
Our hospitals were bursting. Part of the pandemic, the state of Indiana had 1,400 maximum ICU beds. We surged up when the virus is coming in order to deal with what we were going to be facing. Today, there are 1,884 people in ICU beds in Indiana, almost 40% above our usual maximum. On Christmas Eve, if this continues, we will have more COVID-19 patients in ICU beds or in hospital beds in the state of Indiana than at any point in this pandemic. We are tired. We have been able to scale up ICU beds and ventilators, but we have not been able to scale up people. There are no more of me. There are no more nurses. Today, we opened an ICU that's been shuttered for a decade in order to care for 9 more ICU patients at the hospital in which I work. It means I won't be home for Christmas, which is fine. I can deal with that. This is what I signed up for. What I didn't sign up for is seeing people die needlessly. How do I know that people are dying needlessly? Because vaccines work. How do I know that vaccines work? I'll tell you how I know vaccines work. This weekend, I rounded in the ICU. This is an ICU that normally holds 22 patients. We had 35. We can handle that. Of those 35 patients, 15 of them had COVID-19. One of those people were vaccinated with a single vaccination back in February. None of them were fully vaccinated. I can count on one hand of the hundreds of COVID-19 patients that I've cared for in ICUs, the number that have been vaccinated. So why should you get vaccinated? You should get vaccinated because you all know people who, despite their efforts at vaccinating and protecting themselves, cannot be protected. They are people who have had transplants. They are people who have autoimmune diseases. They are people like my wife who has cancer. These people can take the vaccine, but their immune system may not protect them. So what do they need? They need the rest of us to step up and protect them as well. I'm tired. And if I seem frustrated, I am. Because we've been doing this for almost 2 years, and we can't do it much longer. I just want this to end. I submitted to the committee a letter that has been signed by over 460 Hoosier physicians, was because we almost unanimously reject the language in this bill regarding vaccines. Why? Because the message this bill sends is that vaccines are not important. Vaccines are important. They're the only way to end this.
Joining us now is Dr. Gabriel Boslett. He specializes in pulmonology and critical care medicine at Indiana University's hospital system. Dr. Boslett, thank you so much for taking time to talk about this tonight. I know that sort of public advocacy as a doctor is not necessarily part of what you signed up for in this role. I appreciate you talking to the state legislature and being willing to talk to us about it tonight.
Yeah, thanks for having me.
First, let me just ask you if, since that testimony, if the prospects for that legislation have pivoted at all, have changed at all, if you've had any feedback about that very strong statement that you gave them.
I mean, I've gotten a lot of feedback. I don't know that it's going to have much of an effect on the Indiana State House. It's a Republican supermajority. They seem pretty set on sending this piece of legislation to the Senate. I don't know whether or not it'll do that well in the Senate or not, or whether or not it'll actually become law. But the fact that it's even being debated is frustrating.
When you talked about your level of exhaustion and the fact that there's no way to scale up the humans who make our health system work, that you can't make more of you can't make more nurses. You also talked about how so many people involved in the health system, particularly nurses, have burned out, have washed out of the profession because it's been too hard for these 2 years. Given that, I have to ask you what your mindset is, how you were thinking about all this news about the Omicron variant and how transmissible it is. It does seem to be supplanting Delta around the country. It does seem to be much more aggressively contagious, essentially more transmissible. That implies we're going to get a lot more case numbers, and maybe in vaccinated people that won't translate to a lot of hospitalizations, but in unvaccinated people, it seems like it likely will.
Yeah, I mean, I'll be honest, we've been through so many roller coasters of emotions during this thing. And if I think back to last March or April when this was, the original strain was bearing down on us, everyone left the hospital and we started with really low rates of people in the hospital. So if I'm honest, I'm more scared now than I was even when we had no idea what was going to happen when the original virus was coming, because we are starting now with hospitalization rates that are literally higher than they've ever been in the state of Indiana. We've never had 14,000 patients in hospital beds in the state. We normally range around 10,000, and that's where we are today. So if Omicron comes through, and even if it's less severe than the Delta strain, just the sheer numbers of people that it sounds like are going to be infected could very, very easily overwhelm us very, very quickly, because we have no slack in the system.
What is, and I apologize in advance for sort of asking you to go to a dark place, but when you say we could be overwhelmed, overrun, what do you mean? What does that mean in practical terms?
I don't know. Rachel, I don't know what that would look like. I mean, it makes my heart race to think about what that could look like. I mean, it could look like people dying because we don't have enough places to put them, and them just suffocating alone. It means, putting people, caring for inpatients in ambulance bays, which is happening in one of the hospitals here, in conference rooms, which is what's happening here. People don't seem to understand what's going on in hospitals in states like Indiana, and it is absolutely dire. So I don't really want to think about what the worst case scenario is, because honestly, if we come to that, it'll haunt my dreams for years.
If you could wave a magic wand and have the Indiana State Legislature open its heart, open its mind, think about these things differently, move forward with an understanding of kind of dire circumstances that you're talking about and the grave threat that is just around the corner, if you could get the state government to do all the right things right now, what would they do?
The realist in me wants them to just do nothing, right? I mean, from my perspective, if they just did nothing, then any businesses that wanted to have a mandate and enforce it the way that the business wanted to could have that. That's not what they're doing. They're trying to force businesses to they're basically micromanaging mandates for businesses, which is insane. So the realist in me would want them to do nothing. The idealist in me would want them to say, look, we're going to support the mandates on places of business. And we're going to support mandates on even smaller places of businesses than the federal mandate, right? The idealist in me would make them would hope that they would understand how important this is, that literally the policies that they put forth will save lives, literally. And not only that, but will save the economy, because we don't come really racing back until the pandemic is over, right? Look, I'm not going to restaurants now. I'm not going to restaurants till this peak is gone, regardless of whether they're open. So, I just want them to listen to public health officials and not make public health decisions based upon, I don't even know, I guess political aspirations. I don't know what it is.
Dr. Gabriel Boslett is a pulmonologist and critical care physician at Indiana University's hospital system. Sir, thank you for talking to us about this tonight, and come back in coming days. I know that Indiana is in, as you said, sort of dire straits right now, but